vitamin D is a cheap way of staying healthy. There is actually an epidemic or a pandemic of vitamin D deficiency worldwide. Some authors and researchers say that there's about over 1 billion of the population are vitamin D deficient. Who are at risk of vitamin D deficiency? Obviously, it hinges on the exposure to vitamin D. First, if you are dark-skinned, because you have melanin that effectively blocks the conversion of your cholesterol on the skin to the sunlight, the UVB rays, you are more prone to vitamin D deficiency. You need a lot more longer sun exposure than a fair-skinned person. In fact, one study says that dark-skinned people need 6 times more sun exposure compared to the time for fair skin, which is actually about 15 to 30 minutes direct sun exposure, not through a glass. Because anything, glass or sunscreen, direct sun exposure is needed for your cholesterol and for your skin to convert into active vitamin D. Secondly, those that are naturally wearing clothes that cover yourself create little direct skin exposure to the sun. So there are women who are in long clothes or they wear veils. These are people at risk of vitamin D deficiency. Night workers, because they don't see the light of day. During the day, they need to sleep. And so there's little sun exposure. Office workers, anyone who are mostly indoors. Our indoor lifestyle nowadays has pretty much make us at risk for vitamin D deficiency. People who are vegans. Why? Because they don't eat eggs, they don't eat some animal sources of vitamin D. Those with milk allergies, because milk is one of the sources, fortified milk is one of the sources of vitamin D. So if you're allergic to them, you shun away from them. So you deprive yourself of one of the sources of vitamin D. The aged, the elderly, and so nursing home residents. One, because oftentimes they are just indoors. The elderly skin has been found out to have less capacity for that conversion of our cholesterol into active vitamin D. Obese people. So those that are excessively overweight with BMIs of 30 and above. And this is because your body, even as obese, you need a lot more of vitamin D compared to one with a normal weight. Number 10 is a pregnant woman. Because you are feeding 2 lives, you need a lot more of vitamin D to give yourself and your baby more vitamin D. Also, number 11, it depends on which country or how far are you from the equator. People living above the equator, beyond 35 parallel, further north away from the equator where there is more direct sunlight hitting the earth, are more prone to vitamin D deficiency. Those with taking cholesterol-lowering medications like statins. So when you do have low levels, especially very low levels of cholesterol, you may have vitamin D deficiency because the raw material on your skin is less. Last but not the least is the use and overuse of sunscreen. If you are one who, as soon as you get out of the sun, you already have put on sunscreen, and especially because the SPF now has gone way above. So from SPF 15, we actually totally block production of vitamin D from total sunblock of UVB rays into our skin to stimulate our cholesterol's conversion into the forms of active vitamin D. Remember to have that 15 to 30 minute exposure, direct exposure to the sun most days, 3 to 4 days a week without sunscreen. And not through a glass, but direct sunlight and on sunlight direct to your skin. And the best time is between 9 a.m. to 3 a.m. The more direct the sun is on your skin, the stronger the sun, the better. So what is vitamin D deficiency? What levels do we label a person to have vitamin D deficiency? In Australia, we have levels under 50 nanomoles per liter is considered vitamin D deficiency. In the States, they have their units as nanograms per millimole. That defines vitamin D deficiency in the laboratory. And depending on the level below this, you can have mild, moderate, and severe. Optimal health is dependent on not just a minimum amount of normal. It is actually going into the higher range of normal that studies have shown the maximum effect of vitamin D. So it pays to know and have higher levels in the normal range. It's a very safe vitamin D to take. In fact, just one of the precautions here in the toxic levels is for vitamin D to be toxic, you need to have high levels of calcium as well. An exception here is if you have sarcoidosis, you need to be careful. Talk with your doctor about the safe upper limit that you can take, because this is one of the very few conditions where we need to be careful with your vitamin D level intake. We should be taking at least 1,000 to 2,000 international units or 25 to 50 micrograms of vitamin D every day without checking your vitamin D. It's very safe. If you don't know your levels, you want to supplement, a good guide for you would be, as an adult, would be to take 1 or 2 tablets of vitamin D. Standard dosing is 1,000 IUs per tablet or capsule. The required daily allowance that government all over the world, US, Canada, Australia, is recommended of 600. In fact, 400 IUs to 800 IUs is not enough. It's completely insufficient. This is coming from studies. The experts on vitamin D, Professor Michael Holick, who studied vitamin D for so long, and he's an authority on this. He says that 400 to 600 international units per day per adult appear completely insufficient to address the problem of vitamin D deficiency. So our bodies needs more optimal and much higher levels to cause these good effects before reaching toxic levels. If you're enjoying this video and getting important information and aha moments, I want you to please click subscribe and share it to your friends, because these are life-changing, vital informations. It's a preventable disease that has widespread ramifications for our vitality and our health. We seek to educate and empower you to live healthy, vibrant lives.